Hi, my name is Yami. I'm the surgical tech lead here at SNiP-it. Thank you for choosing us as your spay neuter clinic for your babies. Everybody did great. I'm going to go over the instructions of aftercare for your babies. Everything that I'm going to say is going to be on the paper that you're going to go home with. So if there's something you forget, you can just always go back to it and read about it. When you take your baby home, look at the incision. What you see today is what we consider normal. You're going to watch the incision heal the same way that you will watch a cut healing on yourself. Any signs of any redness, any swelling, any discharge, give us a call to arrange a free recheck. We're here from Tuesday to Friday from 7:30 to 5:30. So if you call within those days and we don't answer, or within those hours and we don't answer, please leave a detailed message. I always suggest by start saying my pet got spay neuter in here, and then your question, your concern. That way, whenever we listen to these voicemails, we return that phone call as soon as possible. If something happens overnight, there's also an emergency clinic phone number on the paperwork. It's a clinic around the area. We're not affiliated with them, but they're more than happy to answer any questions or direct you depending on the circumstances that you're having. Most likely, as long as it's not something that is life-threatening, they'll just ask you to wait until the next day that we're here. Over the weekend, if you leave a voicemail or send us an email, we're able to listen to voicemails remotely. So at some point through the day, you'll get a phone call back. Another way of reaching us over the weekend will be through our Facebook page that is linked with our practice manager and our doctor. So it's easier just to take a picture, private message like, hey, what do you think about this? And then that can also get you a faster, more accurate what to do. All the sutures that we use are internal and observable, so they will dissolve on its own over the next few months. Unless it's indicated, nobody goes home with staple or sutures to remove. On the outside, though, we seal the incision with surgical glue. This is to help and protect against bacterial contamination. But if that glue gets wet, it can dissolve too quickly, which means no licking, bathing, or swimming for 10 days. If you notice that your baby is licking, you have to get them an e-collar to prevent them from self-trauma. You can either get one in here or any pet store, and that's when I bring my puppies out because I always like to show people how the e-collar should look like just in case you go out and try to pick one by yourself. Most of them, they look like this. Some of them, they have these little loops. This is for you to loop a collar on. You want to make sure that the collar is tight enough so they don't slip the e-collar off with their feet. And you also want to consider the length of their neck. The nails has to stay inside the cone at least an inch to half an inch. If the nose sticks outside, they'll be able to reach at the incision. I know sometimes we feel guilty about the cone of shame, but you want to make sure that that nose stays inside at least an inch to half an inch. This one in here is $10. We keep this for 10 days. Not we, your pet keeps it for 10 days. We also have the same collar. It's inflatable. It's less invasive into their face. On the outside, it's made out of canvas, so it's pretty good against nails. They both do what they need to do, that is prevent them to leak at the incision. So whatever stress out your pets, it will be the best choice for them. This one in here is $20. If you decide to get either one of them, you can always just let know Miss Ada, and we'll put them on your babies before they go home. Once you're done with these things, don't throw them away. There's awesome stuff to have at home. Sometimes they get the famous hotspots, and then until you get a doctor's appointment to take your baby in, you put one of these on them, and as soon as they stop aggravating that area, it starts getting better. So definitely don't worry. Or if you have another puppy and you spay neuter them, you already got another e-collar for that. The next one, it will be to restrain your pet's activities for the next 10 days. All dogs should only go out to the bathroom on a leash and then back inside to rest. Even though you have a fenced yard, don't let them go outside to go potty on themselves because they can start running around and they can make that incision angry. The same thing works if you have stairs where you live. You can control the speed that they go up and down the stairs with the leash. So leash work for the next 10 days. The females should be kept separate from the males during the recovery time, just because mounting can cause them harm. Also, you don't want them to be roughhousing around the house, making out with each other incisions. So if you have any other babies at home, keep them separate. The male dogs, they have received a scrotal neuter. This is going to experience a little more bloody discharge with the increase of activity, so limiting the activity of the body is important. The type of neuter that we do here, the incision is on the scrotal side. The reason for that is because it's less invasive into their body while it heals up faster. It's less painful for them. So the ones that have big boys, sometimes whenever they sit down, they might leave a little spot here and there. Again, that should not last more than 3 days. If it's something that lasts more than 3 days, or it's a little bit more than a spot, definitely give us a call and let us know. Also, if you have a boy that likes to keep himself groomed down there, definitely a cone for him. Remember that this incision is going to be slightly bit open in order to allow drainage. So if you look at it, it will still look that it's open. There's still something that is getting holding in there together. But if you see any leaking, any swelling, same thing, any discharge, give us a call for a recheck on that. Your pet has received a small tattoo close to the incision site. This is to indicate that your pet has been spayed or neutered should they ever become lost. It's a tiny little green line close to the incision. Don't put nothing on it. Don't pick at it. It's sealed up also with the same surgical glue, so both of them will heal up at the same time. Don't change your pet's diet or give them any special treats. They will still be anesthesia in their system, and you don't want to cause a synopsis stomach. I know that we feel guilty because they got surgery today, but believe me, they got plenty of pain medication. So do not love them with treats. Kind of hold off on the treats for the next few days. When you take them home, you can offer them about a quarter what they regularly eat and also some water. If they don't want to eat, that's fine. Sometimes the anesthesia can also make them nauseous. And it's the same thing like you. If you're nauseous, you're not going to want to eat. So that's fine for them. Unless you have itty bitty babies, definitely you want them to eat today. If not, they can go back to the regular schedule feeding tomorrow morning. Appetite regains back to normal within 24 hours. And again, if that doesn't happen, give us a call and let us know. For today, they already have received the maximum amount that they're allowed to have for pain medication within 24 hours. So today, you're going to take them home, enjoy what is left of the drugs. That is not much. Sorry about that. And then tomorrow morning, once they have their regular breakfast, about 10 minutes after that, then you're going to start the pain medication. Everybody's going to go home with a bottle. It has your baby's name on it and how much you're supposed to give. It's only once a day, and it's going to be for the next 3 days. Even though they don't seem in pain, finish the pain medication that we sent you home, because this pain medication has an anti-inflammatory that is going to speed up the process with the healing. So finish those days for them. That's pretty much about them. If you have any questions or concerns, just let me know whenever I bring your babies out. Line up in here in the order that you came in. Miss Ada will give you your paperwork, and I'll bring your babies out in just a few. Thank you.